Good evening, everybody. Welcome to the Master of Speech Therapy Information Seminar. As you're joining this seminar, I think you are interested to know more about our MST program and the speech therapy profession as a whole. First of all, these are the presenters of this evening. We are from the Master of Speech Therapy teaching team. Without further ado, let's get started. So, first question, what are speech therapists? Speech therapists, or normally we call ourselves STs in Hong Kong, are internationally recognized allied health professionals who provide assessment and therapeutic services to individuals with communication or swallowing disorders. We normally work closely with caretakers and other professionals to provide services to clients ranging from infants to the elderly. In other places of the world, we are called SLP in the United States, speech pathologists in Australia, or SLT in the United Kingdom. The training of an ST covers the full scope of speech therapy service. We work with people from their infancy to the elderly. For children's side of work, for the speech area, we work with speech sound disorder, for instance, the imprecise articulations associated with phonological issue or cleft lip and palate. We also work with other speech disorder, for instance, fluency disorder, also known as stuttering, voice disorder, also known as dysphonia, and the speech problem associated with hearing impairment. For adults, they may also have motor speech disorders associated with brain injury. For the language side of work, children may have developmental language disorder and also some other language disorder associated with autism or other syndromes. And for adult side, you may have heard of the term aphasia, the loss of language among individuals suffering from a stroke or traumatic brain injury. There are also other language disorder associated with dementia. For the literacy side, for children, we will work with developmental written language disorders. A lot of you may have heard of the term dyslexia or dysgraphia. And for adults, they may also have acquired reading and writing difficulties associated with stroke or other brain injuries. And swallowing side of work, we work with younger ones for their feeding and swallowing difficulties. And for the older ones, we work with them for their dysphagia, usually associated with some neurogenic causes. For this evening, we will have a Q&A session by the end of this presentation to address your questions. But for now, first of all, we will cover these topics: the education philosophy of our program, the unique strength of our program, something related to our entrance requirements, and some tips to prepare for interviews. So now let me pass the time to Dr. Leung to talk about the education philosophy of our program.
Thank you. Well, to start off, the MST program was created based on our understanding that we have to serve the following purpose. First of all, we cover the entire scope of service as mentioned by Jeanette at the beginning with 8 different areas. And we want to produce speech therapists who are going to work in Hong Kong, basically. And they are able to also respond to the need from China and also from Macau. The program is designed to equip students with professional and academic knowledge, clinical ability, and also research skills to provide a professional service. And all the ethical requirement in order to achieve an entry-level speech therapist. That's our basic aim of our program. And at the beginning, when we start to design this program, we take reference from different countries' ST programs. Those countries are countries with more advanced speech therapist practice that include the UK, United States, Australia, and Canada. So we take reference from them, and each of these programs have their own advantage and their shortcoming. So we try to get the best out of those, and based on the constraint we are facing, we design our program in a way that it fits into the international standard. So so in the past, we are again with this kind of design, I guess we are pretty confident that we are up to standard, and it is also proved by the fact that our program is an endorsed program by the Hong Kong ISC. Actually, our recent endorsement is at 2023, so about 1-2 years ago, and that means all of our graduates are automatically be able to be registered under the accredited registration. So their name will be announced in the government web page. That means if anyone wants to search who is the accredited ST, they can search and the name will be there after graduation from this program. So so what is the content of the program? So I just browsed through the whole thing. First of all, it's a full-time program. There's no part-time students for this program. And the program is hosted by the Department of Language, Science and Technology. And the duration is 2.5 years, and the total credit is 91 credits. So it's about the maximum we can achieve through a 2.5 years program. And if you look at the program across years and semester, you can have a look at here. So we started off like from year 1 onwards to year 3, we have clinical practicum all over 3 years. So starting from clinical practicum 1 in year 1 and up to year 3, clinical practicum number 7. So altogether we have 7 clinical practicum to look after your clinical thing. And also in year 1, we are doing a lot of traditional lectures. That means all the lectures, type of teaching that you can have in different undergraduate programs. And in second year, we focus on what we call the problem-based learning. I'll talk about this a little bit later. And the third year, we are focused on training you to be a mini researcher. And also, we are dealing with a lot of professional issues that prepare you for your graduations. So altogether, we have 91 credits, and the distribution of credits about 1/3 on the foundation subjects, 1/3 on the professional subjects, and 1/3 on the clinical education. So in the clinical educations, we are going to provide you with at least about or equal to 300 or what we call a clinical supervised contact hours, that you're going to see patient under supervision for at least 300 hours. That's the professional requirement according to our Institute of Speech Therapists. So from this page, you can actually see that how our credits are distributed. For the number 1, 2, 3, and 4, they are of 1, 2, 3. They are of the traditional lectures. Number 4 is basically the problem-based learning element, and number 5 is the clinical education, like the 7 clinical practicum we mentioned. Number 6 is that we're going to have a research project that's to train you to be a mini researcher when you graduate as a speech therapist. And number 7 is about your professional ethics and things you have to be aware of before you graduate. Now let's go back to the PBL curriculum here at PolyU. So traditionally, ST training are usually 2 tiers type of training. So the first tier will be foundation subjects and theory, knowledge type of teaching. And the second tier will be the clinical practicum. So basically, this kind of traditional approach assume that after you have the foundation knowledge, you are going to apply this knowledge through the clinical practicum in your practice. So we find that actually, especially in the master program, the time is shorter than normal undergraduate program. It's a bit too rushed for you to apply theory to practice. So what we do is that we insert a third tier in the middle of it to bridge this kind of transition. So we call it problem-based learning. That means instead of teaching you exactly explicitly what are the area you have to pay attention to, we translate it into problems so that every one of you will be going through those problems, and under guided procedures, you learn the therapeutic process involved. How are you going to look at a particular case, and under guidance of a tutor to go through the professional processes and also reading, etc., to come to a point that you are able to apply theory to practice on paper before you are sent out to clinic for the clinical practicum. Of course, we are not doing it one by one, one step follow the other. Sometimes we parallel. At the time we are having our PBL problem, we are going out to clinic already. So first of all, we have our pure PBL curriculum in the semester 1 of year 2, and at the semester 2 of year 2, then you are going to have your PBL problems, learning plus clinical practicum at the same time. So you can expect a quite busy year in year 2. Year 1, you have the traditional lectures, and year 2, you have PBL problem plus your practicum. And year 3, you have more purely clinical practicum plus professional preparation for your graduation. So this is our program. And before I pass on to Jeanette, I'm just going to introduce to you our professional team. Actually, you can see that we have quite a young team, and we are pretty active in terms of research. So we ask for research ideas and clinical ideas. There will be plenty of it, and you're going to face a lot of ideas coming to you, and there's no lack of idea here. And most of our staff are trained clinically, so they have clinical qualification. And so on one hand, we are professionally ready as a researcher, and at the same time, we have the clinical training for us to help our students to transfer our knowledge into practice. And our clinical team is also, I would say, is one of the best in Hong Kong, because we have a lot of experienced STs. As if I'm right, most of them are over 10 years of experience, and doesn't mean that they are old, but they're experienced, and they are expert in their particular area. So that we have diversities of area of expertise among our clinical team. So I would say this is a very good environment for you to learn from textbook, from our curriculum, and also from our clinical supervisors. And of course, we are at PolyU, so we have the privilege of being in one of the most informed university about paramedicals. So we have OT, PT, and optometrists, and different paramedical professional here, training institution here. In other words, we can collaborate with them easily. So we're just neighborhood. So one of the things we are experience some kind of advantage is that we can share the cadaver they have with our paramedical teams. So this is one of the advantages. So on top of a plastic model, we can actually see the cadaver. Anyone can tell you that the experience will be very different. Was to have a look at what the real human is like. And we have Another advantage of PolyU, I would say, we have all-rounded clinical speech therapist training. Actually, in our transcript, you can see that actually we carefully divide or categorize your clinical hours you get. We try to get a good balance of your clinical hours and make sure that they are there on different areas of your training. This may be important if you want to practice overseas to show that, well, I've training in this particular area before I graduate. And scientifically, as I said before, we have the research part at our year 3, and every student will have to go through a process where they're going to do their final year project. And some of our project is up to a standard of being publishable in a scientific journal. And I've told you just now that we have a very strong professional staff, and we have a very strong academic staff. And they have good ideas for us to learn how to make knowledge and how to verify different theories in our practice. So this is some examples showing that actually our students are creating some of the final year project which are good enough to present in international conferences. So these are our philosophy and also our design of the program. And now I'm going to pass it on to Jeanette for her to tell you what is the unique strength of MST at PolyU.
Thank you, Dr. Lam. So let me, before I go on with the presentation, so I would like to let you all know, I know when we started, and then maybe some of you have been pretty busy at work, so you may be joining late. So I just want to let you know that we will be leaving time for question and answers by the end of our presentation. So you're very much welcome to turn on your mic and ask questions later. But you are also very welcome to type your question in the chat box. We have colleagues here that will be taking care of your questions, and then later we'll collect them and they will answer in one go by the end of our presentation. So please feel free. Now, that comes to our unique strength of the program. Just like Dr. Lam mentioned earlier, to train a speech therapist is far beyond just theoretical knowledge, because we have to know how to actually conduct the therapy. So first of all, and then people usually will ask, a lot of people actually, they start thinking about speech therapy, or they talk about they're interested in pursuing a speech therapy program. Then they will say that, oh, I really love children. I like to work with children like that. However, I would like to also mention to you, there are different job opportunities for speech therapists in Hong Kong. And of course, there are different countries. It's a little bit different when we talk about job opportunities, and also across time. So in Hong Kong, some of us may be working in preschool setting. So there are a lot of residential area. You may be coming across some early education training center or special childcare center. So these are preschool settings. And also in a lot of kindergarten, we actually have speech therapists working there. And the other is school. So school-age children, so they will be served by speech therapists, either in mainstream school, the regular primary and secondary schools. And also there are special schools in Hong Kong. They are all having STs in their schools. And in special school, most of the time, one special school, there will be a couple of speech therapists. And in mainstream school, more likely it will be one ST serving 2 to 3 mainstream schools, either primary or secondary. And then when we are going to the later part of our lifespan, of course, there will be different adults. They may need speech therapy services. However, it will be more often that the older you get, the chance that you need health and medical services will be higher. And in elderly, and then we will have some different, what we call normally in layman terms, the OH home, the residential care for the elderly. And also there will be, there are certain daycare center, they will also have some service of speech therapy. And in recent years, the Social Welfare Department, they also established what we call MOST team, the multidisciplinary outreaching support teams for the elderly. So they mainly serve a residential care home in the private market. And Apart from children and elderly, there is another area that speech therapists will work with that is called the rehab setting. So the rehab setting is mainly for individuals with different disabilities. And a lot of time we are talking about intellectual disability. So for the employment outlook, some people, they may be interested to know what is the salary range of a speech therapist. So I'm here to tell you. Something we are sure about that to be a speech therapist, usually you will not get to be super rich. So sorry about it. And then, this is the salary scale. Most of the time in Hong Kong, most speech therapists are being paid when they are fresh graduate, then they are being paid at master pay scale, which is I extracted here, 0.16. So currently it's at 36,850 Hong Kong dollars. And you will get increment and salary adjustment year after year. Now, this is what we know now, and I'm not sure whether it will change later on. Because I think a couple of days ago in the news, there's a discussion on that, whether increment should be automatic. So, but currently, and then it's 0.16 to 33. And if you count, so after working for more than 10 years, less than 20 years, then the salary, monthly salary will be up to more than 81,000 Hong Kong dollars per month. And if you see this is the green box here. If you see the blue box there, there are some opportunities that ST can get promoted to higher rank positions. Then the salary level will be from 0.34 to 0.44. So of course, there will always some other opportunity. People get promoted or people operate in other, for example, private setting, they may be running on different salary scale or different payment method. So this is for your reference only. Now, so far, MST has been, we established MST in 2014, is it 2013. So we actually have more than 10 cohorts of graduates who have been graduated from the program. And so far, we see that they have been pretty popular among employers. As you can see here, then employers or colleagues in different settings, they tend to give pretty positive comments to our graduates. So this is something that we are happy about, that our curriculum and our design may be working well in the profession, not only the way we design, because eventually the student need to graduate and then they will be entering the professional career. So we also hope that they will be seen as a valued member of the ST profession in Hong Kong. Now, Dr. Leung talked about the curriculum a bit, and this is more on the clinical education curriculum. That means most people will be interested to see, okay, what kind of clinical placement I will have. As you can see here, you will be working with pediatric children cases, school age, and also preschool settings. And for adults, that you will work with neurogenic cases in communication disorders and also about swallowing disorders. And for the third year of study, you can see that we have fluency clinic, voice clinic, and also you will have external placement you will have placement outside of the university clinic. You will also have clinical supervisor outside the university educators. So this is something that we never know that whether a student will end up in a more adult clinical setting or a children clinical setting upon graduation. Even students themselves, they are not really sure about it because you're on the way learning. Sometimes you cannot know all the disorder one at a time. But you explore it throughout these kind of clinical placements. And if you ask me whether you have a choice on clinical placement, so I am sorry to tell you that you don't have a choice. You have to go through all these 7 clinical placements as you're being assigned to. And then in order to gain over 300 hours of supervised clinical practice in order to fulfill the graduation requirement. So this is one of the photos that I'm showing you. In addition to this online seminar, so we always run an online information seminar on our program this time of the year. And later in January, we will have another information seminar. Another information seminar will be conducted in Cantonese, and also it will be conducted on site at PolyU. If you're joining the next information seminar, you will also have the opportunity to visit our speech therapy unit, and usually we will also have some current students that are talking to you to share their happy or horrible time here. And this is our speech therapy unit. In addition to the cadaver laboratory and also other facilities, this is one of the facilities that our students will spend pretty much a lot of time here. They will be here looking at clinical resources, and also they will be here having some of their clinical placements. So, and in addition, the STU is also a place for research and also for clinical services to the general public in Hong Kong. And these are, before that, you can visit us in January. You can take a look at the photos. And then there are some clinic rooms that we have for speech therapy. And we are thankful that we have more than 10 clinic rooms that we can use for concurrent clinical placement. That is very important for us because it can ensure that our student will have adequate space and adequate clinical hours to be obtained in this throughout the program. And in addition to that, we also have some other meeting rooms. And at the middle one, you can see that this is our video review room, because a lot of time when you do clinical placement and then everybody learned that way, you need to review your own practice and then see what you have been doing well and then what kind of improvement that there should be. So students usually will review their videos after clinical placement as arranged by their clinical supervisors in order to learn from that. And we also have some hands-on experience, for example, with hearing screening. So students there were trying to practice the use of audiometer in order to do some community hearing screening. Partly because although we are not audiologists, we do need some kind of skills to rule out hearing problem quickly in order to make the appropriate hypothesis for the problem of the case. And here you can see that for the clinical practicum, so some of that we can conduct it at school, and then thanks to COVID, I think all over the world, all the speech therapists has learned the skill to conduct tele-practice, either using Zoom or I think we can use all the platform available, WeChat and Skype, all those platforms that now I think is pretty popular. Before that, I think Hong Kong is pretty small, so this kind of a tele-practice has not been very well established. But right now, I think time change. So this become part of the clinical practice of all speech therapists, I can say. And you can see that we also have elderly residential care there. And in Chinese mainland, we also, all our students will have to conduct 15 hours of clinical placement within the Chinese mainland. For certain years, we also have students going to Macau, but I think these 2 years and most students, then we will arrange them to go to the Chinese mainland. And in mainland, because speech therapists are a less developed profession compared to a lot of Western countries and also in Hong Kong. In Hong Kong, ST has been developed mainly starting from the 70s, and Hong Kong has the first program in 1980s. So we had pretty much a long history of ST education and practice in Hong Kong. But in Chinese mainland, the story is not the same. But you can see that our students will visit to different placement site, for example, residential care, children's service, and then we'll, in addition to conducting the individual and group therapy, you actually see that we will also do some staff and consultation. But the good thing is that I think the majority of our students, if you're growing up in Hong Kong, a lot of you, then you can be very fluent in both Cantonese and Mandarin, because you need your fluent Cantonese to conduct placement in Hong Kong. The majority of a local population in all clinical settings, they're Cantonese speakers. And then in the mainland side, we do both. For certain clinical sites in within the Guangdong province, we actually use both Cantonese and Mandarin. And a lot of time we will have these placement within the Greater Bay Area now. So this is something we do. And we're also very thankful to a lot of external clinical placement partners, because our students not only they will have the clinical placement in STU, that the picture that I showed you earlier, they will also have their placement in different organizations, for example, hospitals, children's service centers, schools, special schools, etc. And I think Dr. Leung mentioned earlier that PolyU has its own uniqueness, that because we have a lot of different allied health professionals within this PolyU roof. So a lot of us that that we train PT, OTs, optometrists, nurses, radiographer, medical technologists, etc. And when we are housed within this Department of Language Science Technology, actually, we just retitled our department. Our department had been previously called Department of Chinese and Bilingual Study. However, in order to reflect the more latest trend of the research and the teaching that we're doing, so our department has just been retitled at the 1st of September this year, so which is a month and a half ago. So, however, we have always been a department with linguistics component, with translation and interpretation component, and also with speech therapy component in our department. So we have the strength to work with a lot of linguists that we actually learn from them, and then we will have a unique strength that we can deliver Chinese and bilingual, or now we call multilingual service to individuals, because now we are looking more at the diverse cultural diversity and linguistic diversity, even within Hong Kong. Due to there are different migrants, either from Chinese mainland or from Southeast Asian or South Asian countries. And also, in addition to the team that you see, you saw quite a little bit, a lot of little hats there, right? Dr. Leung showed you those slides. And actually, we can say that we are rather a stable teaching team. As you can see, from the picture that we show you, all those people that you see in those slides, they are full-time academic members of this university. So we believe that a stable full-time team would be able to help training a speech therapist better in a way. And also PolyU, we pride ourselves that we are very good at, or we strive to achieve the best in applied sciences. So these are some of the behind-the-scene learning and teaching activities. So as you can see that we have clinical placement, the two photos, you can see that basically they are working behind the single-sided mirror, and then so that people inside the observation room, they can observe what's going on inside the clinic room, while the other classmates are working on that. And then we also have the clinical supervisor also in the observation room looking at the student inside the clinic room. And one thing you need to be good at, you need to be good at sitting at the children's chairs. So you see that all our students can sit on those little chairs very well. And I found they're just like wearing school uniform there, or looks like very much the same in that photo. On the right-hand side, you see that we have Dr. Leung introduced the problem-based learning. So we call PBL in action. You see that our students I think they are drawing concept maps, or they are raising some question for discussion together in the problem-based learning. So. And these are some other photos that we would like to share with you from on the left. And then you see that these are some placement they have done in the mainland. And in the middle part, of course, the happy one is that mission completed, in which that is the graduation photo. So we are very happy that we are going to welcome our next congregation very soon. Then we will have graduation date again in early November. And down there you see career planning. We do have some MST alumni. They are very much willing to share their career path and some prospect that with their 師弟師妹, right? They're juniors upon the time they graduate. And we also have some other activities that we would like students to get involved in the community, not only for speech therapy related service, but other services as well. And just earlier this year, we also had some, because we have been away from COVID for some time, so we've decided to do something different this year. So we've got international exchange. What is so special about this is I think a lot of you, if you're looking at postgraduate education, so you already completed your undergraduate education. I know nowadays most undergraduate students, they have a lot of opportunity for international exchange. However, if you're going for professional studies, for example, this type of speech therapy training, the problem is that your curriculum has been very packed, and it's very, very difficult for you to get time for exchange. Another one is that even you can go out for exchange, it is very difficult for people to get the exchange which is relevant to their own major study, which is speech therapy. But here, this is some photo that we got from Singapore. As you can see in the middle, the one with like a lot of jacket, that one. And then actually those are this is a room that is for X-ray for swallowing. So our student got to go into a hospital, then to learn from the clinician there in Singapore, and then to see how they were doing, how they were administering their work in Singapore. And of course, and then I think in August, and then we also have a group of Singapore students coming back to visit us in Hong Kong. There's inbound exchange, so that then students will have chance to communicate with some their counterparts in other countries. Then they are also future speech therapists. So also we would like to let you know that how much a credit course you can easily find it on the website of the top postgraduate admission website online for PolyU. And we would like to share with you about the scholarship. Our department has established a distinguished postgraduate scholarship in speech therapy for our MST student. So every year, up to 10 scholarship per cohort year, which is applied to Year 1 and Year 2 students. So by the end of the first year and by the end of the second year, then they will be selecting a maximum of 10 students to get the scholarship. So each scholarship will be 40,000 Hong Kong dollars. So if the students' academic performance, we look at both academic performance, which is about GPA, and also the clinical performance, how they perform clinically in clinical placements. And so if the students are so fortunate to get this scholarship consecutive 2 years in a row, then you will be able to get $80,000, which is more than 13% of your tuition fee. And the good thing is that you don't need to apply for that because you are automatically enrolled in the scholarship. And then you will be notified if it has been after the selection, after the approval, and then you will get this scholarship. And for the third year, because it's 2.5 years, that means we have Year 1 and Year 2 and Year 3. So the Year 3 student, they don't get the scholarship anymore, but because they are graduating, so the graduation class, they will get another prize. This is the prize for distinguished postgraduate student, particularly for our MST program. So this is basically GPA linked. So if a student can get graduation award GPA of 4.0 or above, then they will get $10,000 as a prize. So every year there will be some student getting the prize, and then we are very happy for them. And if you're interested in credit transfer, so I would advise you to contact our general office after you're being admitted by our program. So there are a bit of details on how we do credit transfer across our program. Most of the time it's about if you have some postgraduate master's level of training, then you'll be qualified for credit transfer. But there will be some exception. If you're a poly graduate, you have completed certain course at certain grade level with certain GPA, then you may be qualified for credit transfer. And very much if we look ahead, and then we will share some information on interview schedule and application schedule and so on later on. However, if you're being admitted to the MST program, usually officially the university started our first semester in early September. However, please be reminded that you will be expected to join the orientation. Now, the orientation day for MST is not just to make new friends. There are quite a bit of information we need to share and also about the expectation of the program. So it's scheduled in late August, and then you will be stay tuned, and then if you are being admitted to our program. And following this part, and I will pass the time to Angel. Angel will be sharing with us on some information about entrance requirement. Please, Angel.
Thank you, Janet. Hello, everyone. This third part on entrance requirements is pretty factual and straightforward, and because we'll also upload the slides and the video right of this session, so you do not have to jot down all the details while you're listening. Right, so as this is a master's degree, we do require students, applicants, to have had a bachelor's degree from a recognized university. And as Dr. Lang has mentioned, the study of communication disorders or speech therapy practice is informed by a number of supporting disciplines, including linguistics, psychology, speech and language sciences, medical or health-related disciplines. And therefore, we do give preference to applicants who have had formal training, especially in the form of a bachelor degree, and these related supporting disciplines. Having said that, we do and we have been admitting students who haven't had the bachelor degree in these supporting disciplines. Would still consider them as long as you can convince the panel that you're strong enough in terms of your academic promise and your attitude, that you're suitable to become a student speech therapist. We would still consider and admit these students. And we do have students as such who were able to shine in our program. So if you don't have these bachelor degrees in these supporting disciplines, don't hesitate, still apply, right? Okay. Now, entrance requirements, English proficiency, this is rather straightforward. So you see a number of bullet points here. We do recognize a number of public examinations, including Hong Kong BSE, Hong Kong A-Level, IELTS, TOEFL, IB, and or the equivalents, like for example, CRE, we would recognize use of English level 2. In each of these examinations, we have specified the level or the scores required, the minimum scores required. So you can take reference to this slide. And note that we put down or, meaning that you only need to provide proof from one of the following. And do pay attention to the small bullet points at the bottom of the slide. And there is this validity period for TOEFL and IELTS results, and that's 2 years. And to specify the cutoff date, it will be that we accept test results of test dates on or after the 1st of July 2024. And some other tests, such as TOEFL, IBT Home Edition, IELTS Online, IELTS Indicator, and IELTS 1 Skill retake test results will not be accepted according to the university guidelines. And we do require applicants to be able to communicate verbally in English effectively. And the last bullet point is actually a FAQ from our applicants. We have no exemption for native English speakers or applicants holding bachelor's degrees awarded by institutions where English is minimum instruction. Following the usual practice, we do require objective proof. This allows us to have an objective proof of demonstrated evidence of English proficiency. Yeah. Okay. Then the next slide is about Chinese proficiency requirements. Again, you see a number of bullet points. We do recognize a number of public exams, including Hong Kong DSE, Hong Kong CEE, IB, SHSK, HSK, or the equivalent. For example, CRE use of Chinese, it will be level 1 or above. In each of these bullet points, you would also see the level or the scores or the grades that we expect, that we require. And you also see an or here, meaning that you only need to provide proof from one of the following. And please note that UK IGCSE A-level Chinese results are not recognized. And then you see the smaller fonts at the bottom. And this would concern the validity period of the HSK and SHSK results. Similarly, the validity period will be 2 years. And you see the same cutoff dates here. It will be on or after 1st of July 2024 for your date of testing. And we do expect that applicants will be able to communicate verbally in Cantonese effectively, and proficiency in Mandarin, Putonghua is preferred. And the last bullet point is also FAQ from our applicants. We have no exemption for native Chinese speakers. We do require objective proof of Chinese proficiency as demonstrated evidence of your proficiency in this language. Okay, now if you are considering to take HSK, then you go to the website, so you can scan this QR code, and this would direct you to the website, and you'll be able to know more about the details about this test. And it's about 140 minutes long. That's the score requirement, and you can see from the schedule, in this table, they have posted test dates till December. So do pay attention to, you can still register for the November or December round. For the later rounds, to watch out for the new announcements by the website. Okay, now other entrance requirements, we do expect a personal statement addressing the following. And the first will be your understanding of speech therapy and your commitment to speech therapy as a career in Hong Kong and or mainland China. Second will be how your previous studies or experiences support your application, highlighting relevant study, work, and personal experiences that are related to speech therapy. The third will be explanation of any other factors that the admission panel should consider for your application. In terms of length expectations, it will be 800 to 1,000 words and in English. And this is optional, but encouraged. 1 to 2 recommendation letters addressing your qualifications, relevant work experience, and other achievements. And we do value recommendation letters from references who know you well and who are able to give, elaborated and candid comments on the following points. And these are the points to note. So please upload all supporting documents via the e-admission online system, including the following. Normally, applicants will not be processed unless with full provision of supporting documents, but we do recognize that they have been quite a lot of students who are like final year bachelor degree students. And for current students who are expected to graduate in this academic year, and also applicants with expected results of language proficiency tests to be released, you can still apply without full provision of the relevant documents. What you can do is you provide proof of your study status for your bachelor's degree. For example, your transcript, okay, your current transcript that highlights the subjects you've taken so far and grades that you have achieved so far. And also, or documents showing the date of your relevant language proficiency test. So a proof that you've registered for particular tests of language proficiency. All right, so that's the end of this part. I will pass it on to Olivia for tips to prepare for interviews.
Thank you, Angel. Good evening, everyone. Okay, it's my turn to talk about the tips to prepare for the interviews. And before talking about the interview, let me show you some historical admission data of MST program. Here you can see that the pie chart is showing the MST admitted students by institute. As you can see, most of those students are from local institutions, and we do have students around less than 20% of students are from overseas institutions. And we do have some students from other region of the Greater China institutions, and most of them are from Guangdong province, right? Yep. And then another piece of information, and this is our students by discipline. As what Angel said, we have preference in admitting students from certain disciplines like linguistics, psychology, medical and health related subjects, as well as speech and language sciences. However, it doesn't mean that we don't have students from other disciplines. In previous years, we do have students from like journalism and business. Okay. Instead of admitting students from certain institutions or from certain disciplines, we are indeed looking for someone who are prepared and who have the quality and determination to become a helping professional. So here are some key qualities that those students should have, including strong academic and intellectual competencies, appropriate attitude and willingness to learn, adequate language abilities for effective communication, relevant experiences in the field, and having the willingness to have potential impact to the profession, as well as strong stress management capabilities. Okay, let me talk more about what an ST must have. I have listed the attributes of an ST. Instead of talking about these bullet points one by one, I would like to highlight some of them. The first one that I would like to highlight is the sincere interest in helping people. ST, for me, I think is a helping profession, and having the genuine interest in helping others is very important. I think the goal is not to earn money, because we cannot be very rich.
We still earn money, but
Not very rich. Okay. The other point that I would like to highlight is the commitment to work cooperatively with others, because no matter which settings we are working in, like hospital settings or school settings, we work with different peoples. Like in hospital settings, we work with medical doctors, we work with nurses, physiotherapists, occupational therapists, as well as like the patients and the caregivers. So we need to work with others. So the commitment to work cooperatively with others is very important. And then the last point that I would like to highlight is the attitude of embracing challenges, because every single day we have new cases. It's impossible for us to learn all the knowledges we need to cater the cases in just 2.5 years, or in some other courses, more like 5 years. It's impossible for us to learn all. So we have to learn after graduation. So the attitude of embracing challenges is also very important. Now, the most important part is the MST admission interview. In the coming admission interview, there will be 2 parts. The first part is the group interview, while the second one is the individual interview. The group interview will last for around 20 minutes, and it depends on the number of candidates in that particular group, and it will be in English. And we will arrange it, we call it a PBL taster because we will arrange it as like a PBL tutorial. And the interviewer will provide you with some information and then guide you to have discussion among the groups. And of course, the interviewer will observe your performance in the group. And then after the group interview, the candidate will be divided into different groups and will be involved in individual interviews. During the interview, there will be 2 interviewers interviewing you, and the session will last for 15 to 20 minutes, and it will be in English, Cantonese, and Mandarin. And of course, at the beginning, we will ask you to introduce yourself, and then afterwards, we will ask follow-up questions according to what you tell us. And the main goal is to get to know more about you in person. So there's no need to pretend to be someone else. Please be yourself and be genuine. And as what I said, at the beginning, we will ask you to introduce yourself and we will ask follow-up questions. So basically, we don't have standard questions. And of course, we don't have standard answers. So there's no need for you to guess what we want as answers. But in order to prepare yourself for the interview, please make sure you have background information on speech therapy. For example, the range of clients, the clientele, the services available in Hong Kong, as well as the potential future development of the profession. And please dress professionally. It's okay not to wear suits to the interview, but please dress professionally, no matter if the interview is in person or through Zoom. And the last point, but the most important one, is be punctual, because the group interview will be carried out first, and we will start according to the schedule. And there's no way for us to give you extra time if you are late. And if you are too late, it's possible that our staff will not let you in because maybe only 2 minutes left. And even if you are enter the room, you can't do anything. So please be punctual. Okay, the timeline. Okay, as you can see on the screen, there are several important dates. And the first one is the application start day. It started on the 2nd of July, 2025, some times ago. And then there will be 3 rounds of application deadline. The first one, the early round application deadline, will be on the 15th of October, 2025. That is coming Wednesday. And then the main round application deadline will be on the 15th of January, 2026. And then there will be an extended round application deadline, which will be on the 28th of February, 2026 next year. And basically, MST admissions operate on a rolling basis. And interviews will be conducted during the application period or until all places are filled. And we will shortlist the candidates, and the shortlisted candidates will be invited for an interview as part of the admission process and admission and the selection process. And basically, the interview will be in person. But if you are applying from outside Hong Kong, you are studying outside Hong Kong, and you would like to apply, it's okay. We can provide Zoom option for the interview. And there will be 3 interviews. The first one is in November, and then January interview, and the third one is in March next year. The first November interview will be on 13th of November 2025. And in this round, we will consider applications received by 15th of October 2025. While for the January interview, it will take place on the 9th of January. And we will consider applications received by the 5th of December 2025. And then the last one will be the March interview, 19th of March 2026. And during that interview, we will consider all the applications. And we won't provide makeup interviews because if you fail to attend the scheduled interview, of course, you can contact us, but we cannot guarantee we can offer another chance for you to have the interview. And all applications, normally we will notify the admission results no later than April 2026 or until all places are filled. So here is the code for e-admission. If you want to apply, you can scan the QR code, and the first round or the early round deadline will be on the 15th of October 2025. If you have any question, you can email to the academic registry or contact through this phone number. It's okay not, you don't need to copy it because we will later upload these slide on the web. Okay, and then here is the e-admission document checklist. There are some required documents, including bachelor's degree transcript, the proof of English and Chinese proficiency, as well as the personal statement in English. And another optional document is the recommendation letter, which is encouraged. Okay, and then if you try to apply for the place, this is what you will see on the web. The left-hand side, if you you can see the left-hand side, can you see the green box? The green box is the most important one. If you see the green box, like the left-hand side, awaiting payment, it means that you have submit the document, but not yet settled the payment. If you see this, please pay the payment first. Otherwise, we cannot process your application. And then the middle part of this slide, you can see two boxes. One is the application being considered, and the other one is on waiting list. If you see these two slides, it means that your application is being processed. And it means that you may or may not be invited for the interview, and you may or may not have completed the interview. And then on the right-hand side, you can see offered a place. Then if you see that, congratulations, you have been offered a place. Okay, to sum up, you may check if MST is suitable for you. The first point is MST is a full-time master's degree of 2.5 years. And we provide a curriculum covering full scope of service. And we use a hybrid approach of learning through both lectures and problem-based learning. And in MST program, a clinical education curriculum of more than 300 hours of supervised practice will be offered. And our clinical practicum prepares graduates to practice competently in various clinical and educational settings. And the last one, our teaching team believes in students' ability to excel. Okay. Let's move on to the question and answer section.
So just like Olivia and others mentioned earlier, so the presentation slide deck will be organized and it will be uploaded to the web within a week because we will also handle the video recording of this session so that people can get to see more information.
Yeah, maybe we can upload the slide first.
Yeah. So you will see it within a couple of days. And and then for some of you, if you join us later today, our Q&A is arranged this way. If you would like to ask questions using the microphone, you're more than welcome to do so. You can use the raise your hand function, and then we can invite you to share your question. Alternatively, you are more than welcome to type your question in the chat box. And then so we will be collecting the question because there are sometimes candidates may ask similar questions. And then so we will be collecting these questions so we can answer in one go. So let's start now. And so I've got some questions on some statistics first. So the question about our admission number, so I can share with you last year, that means the cohort just started 1.5 months ago. The cohort started in September. They started their MST year 1. So for this cohort, we have admitted actually 30 students at the start, and eventually we have 29 students starting in September. The reason, as far as I can recall, is there's one student was unable to submit the language qualification requirement. So that's why the student was unable to meet the conditions of the program. So eventually, even we offer the conditional offer, then the student cannot make it. So we end up started our semester with 29 students. So the second questions I've got on statistics is about the employment rate of our student. Now, well, of course, we cannot track all the students, but we do have some information on the student. As far as we know, the student, they are willing to look for a job, they would like to work, and then that the employment rate has been 100%. So we didn't see that student have problem in securing employment after graduation. And of course, I will very much is the choice of the student. Some of the students, they may want to pursue full-time employment, and then some of the students, I think now I think a lot of younger generation, they would like to pursue some slasher career. So some of them, they may want to work for freelance. I think that's the personal choice. But as far as I know, the students don't have much problem in securing employment so far. Yeah. So Angel, language.
We've got a couple of questions regarding language requirements for qualifications. One is about the Cantonese requirement. Will Cantonese be used in classes and therapy sessions? The short answer is yes, we do, especially the therapy sessions, the clinical education courses, because we do regularly see Cantonese speaking clients. And there's another question on English. What's the weight of English as the medium of teaching compared with Cantonese and Mandarin? Well, according to the university policy, basically, PolyU, our university, is 100% teaching in English, with the exception of clinical subjects. Regarding clinical subjects, since we are seeing many Chinese-speaking clients, so it will be supplemented by Cantonese, or if you come across Mandarin-speaking clients, it could also be supplemented by Mandarin. However, please note that all our courses and our academic courses will be conducted in English, not Chinese. Okay, it could be supplemented with Chinese if we teaching specific modules, for example, like teaching Chinese grammar related content. Okay, and then there's another question. Any conditional offer for applicants without required English proficiency at the moment? The answer is yes, we do, but you will need to submit the English qualifications proof according to the meet conditions deadline. So there is a deadline for meeting conditions. Yeah. Okay, and then there's a question regarding Chinese again. Is the result of CRE counted or not? Yes, according to our slides, we have put down all equivalent here, and that should be level 1, I believe, right? CRE Chinese proficiency. Yeah, thank you, Janet. Yeah, level 1 or above. Yeah, CRE use of a Chinese level 1 or above. So let's see from this slide that it's recognized. Okay, so that's all for now. For admission, I think we have answered.
Oh, that's good.
John has
Oh, okay. So the Chinese would have. Yeah. So about admission number again. So the number of students per cohort. Historically, I mean, we have been running this program for more than 10 years. So I think our largest cohort is 46 students. And our smallest cohort so far was 29 or 30? Yeah, it should be 29. So it's so far it has been like that. And then I think people are more interested in how many we will admit in the coming year, right? And then, so it's about, I think it's about around 30. So this is the plan, but just like what we mentioned, sometimes so sometimes the plan will change a little bit. And also I have a question here on some additional volunteering works. I think there's a question here. Would there be any additional exposure to work with STU or the research team as volunteer? Actually, I can answer for them. I think Dr. Lan used to have some student RA to work with you on the language sample analysis project. And I think Angel worked a lot more with developmental language disorder for children. So then they have been on and off. Then we will have if they have research money, and then we will they will have chance to hire student helpers. That's one thing, and that's also there will be other university work. I think on and off. I think Olivia and I we also got a project before, and then on some teaching and learning activities. Sometimes when we have a research money, we also have project that we will invite students to help, and. Volunteering with what STU, okay, I would be very happy if students want to volunteer with STU. Why nobody want to volunteer with us?
You're welcome to call us and leave your contact behind.
No, I mean when they are student with us, right? We don't accept outside volunteers, external volunteers, but then when student with us, I actually think that they're actually too busy with their work already. So they seldom have volunteering opportunity with us. And go back to another question about, I think I have a question on how, I think Olivia shared that, let me go back to that slide. I think some of you are interested to know this about timeline. So if some of you had been applying to our program before, you perhaps can identify its guess to be changed a bit on the timeline. Previously, we have January interview, and we also have March interview for quite many years in our way of administration for this program. And but due to PolyU added an early round application deadline, which is the 15th of October. So we have added a November interview on 13th of November. So I have a question: how many will be interviewed in November? Actually, I cannot tell you at the moment because we haven't seen all the application yet. And yeah, it depends on how many applicants are there. Well, it's so unfortunate that nobody applied for the deadline. I think it's not true, but because Olivia said that there are some numbers there already. Yeah. And so how many, right? We have 50 right now in the pool. But the problem is you have to pay. If you don't pay, and we can't see them. And then so because why the payment doesn't go to us, but then it's not paid, and then we can't even see the application, the details. So we will see how many. Obviously, we have a panel of interview. We have admission panels. Then they will be our staff members. We serve in the admission panel on a rolling basis, actually. So we will see all the application. Actually, all the application will be seen by a couple of our colleagues in the team, and then. Whether the applicant gets shortlisted, it will be depending on the admission panel. So what happens is that if you will be shortlisted for the November interview, then you will be coming to the interview. Each applicant will only come to one interview, and then. But if you're not you applied before the 15th of October, and if you are not invited for the November interview, chances that you may still have chance to be invited for interview because you may not be invited in the first November round, but then you will still be considered in the subsequent round of interview. It's that's what we said. We are on the rolling basis, and you can answer this, right? Yeah. Someone asked
about the first round interview notification date, and we've planned to send out the interview invitation on or before the 6th of November.
So usually, because as you see that we run through quite a tight interview schedule. Once the application is received, it has to be vetted by admission panel, and then there will be some administrative work associated with that. So basically, we aim to invite people to come for interview about 1 week before the interview date. That's why we try to put the interview date here. So if you're applying to the program, then at least you can get prepared for those dates. Yeah. Yeah. Let's see. So see. Yes. Okay. So the one question is about the weighting of or the importance of the CV and personal statement. Now, CV, of course, is important. The CV is what your previous education, your previous job, your previous volunteering experience, they all go into your CV. And a personal statement, and it's also, we don't have an exact rating, waiting for that. So what happened, I can tell you a little bit more because people are usually interested to know how do we vet applicants. So we have an admission panel. They are all current full-time teaching members of our program. And then they will see your CV or your application in the system, basically details of your CV. And then they will see your personal statement. They'll read actually all the people also wondering, actually my current student, they will always ask whether we read their statement. I'm 100% sure that we read all the statement. And also the reference letter that you submitted, and then we will see the reference letter. And then we actually consider all the applicant with all as a basket of factors, and that is the overall is the overall rating that we will get to an applicant, and then to see whether this person we believe that will be fit for the program. So that's why what you submit is very important, because before we can actually see you, we can only base on what you submit in the system, and then we can vet the application accordingly. And okay, there's a question on number of quota allocated to mainland student. There's no quota allocated. We only have an overall quota of our program, so it will be around 30. So it's because sometimes we have some adjustment when we are doing the admission process, but it's around 30 places that we are offered to September 2026 cohort. And so it varied. We admit student based on merits, so there's no assigned quota for people from anywhere of the world. Historically, so we have majority, they are local Hong Kong ID holder, Hong Kong residents. We do have for certain cohorts, we have students from the Chinese mainland, and we also have some students from Macau as well. So that's just the historical background. And is it necessary to have the placement in China? China, you mean refer to Chinese mainland? Yes. In our program, all students have they do need 15 hours to go to the Chinese mainland. So if you do not, for certain reason, you do not want to have this kind of placement, then I'm sorry, but you can't fulfill our graduation requirements. So yes, it is mandatory, necessary. So because the reason is because we all know that the mainland part of China, then the speech therapy professional development is developing, but it's not as developed in Western countries or in Hong Kong. So we believe that our graduates will have a lot more opportunity later going forward. So far, we see a lot of our graduates that they can see, all the graduate in Hong Kong like us. We can be seen, we are an advocate for the speech therapy profession in places beyond Hong Kong as well. And whether we will consider some other health professional to apply, yes. We always have, let me recall, we have nurses that they apply to our program. And just like I think Olivia mentioned earlier, we do consider some undergraduate with priority, as you can see from our pie chart too. But it doesn't mean that if you are a graduate in linguistics, then we will admit you right away. Or if you are a law graduate, then you are at a disadvantage. Eventually, it's a priority, but then it's merit-based assessment when we are doing admission exercise. So I do remember that we have very good student with civil engineering background. I think she'll be coming next month. I invite her to do a sharing here. And then so we do have different people. They are having other professional or qualification, or people from teaching profession, they're teachers, and they apply as well. It happens. And how many applicant last year? I can't recall, 100, isn't it?
More than 200.
Yeah, usually
30.
two, 300 of applicant. It's changed year after year, but we usually have a pool of a few hundreds of applicants. And percentage of applicant being offered an interview.
30.
About 30% usually. Overall, due to our constraints of manpower and time, we interview about 100 applicants every year. 100 applicants. So, but this is the first year we have 3 rounds of interview. So right now, we're not sure that we will be offering more interview opportunity or less interview opportunity. Eventually, I think we have been running the program for quite some time. So we also know that our shortlisting mechanism, what kind of applicant will be more likely to succeed in the program. I think for us, and then I think Olivia did mention that you should have some stress management capability. To be honest, I can't say that professional qualification bearing program such as in MST is very easy. I will never say that. I would say that even back to the time that we were doing our own degrees, I won't say it's very stressful. Of course, the perception of stress is individual differences. I would say, but I would not say that it's an easy program. It will be a lot of components, very busy, a lot of readings, and so it's not really. I would say it's not stressful.
A lot of questions for you.
Yeah, really.
And Olivia.
Okay, let's take a look at some of them. So, okay, provide screenshot of academic grades. Oh, academic grades. I'm not sure whether it's. I don't have a screenshot from this one. I understand. Okay, so it's about the documentation for application. So if you provide screenshot of academic grades in lieu of transcript, I think like that. Now, okay, if you already graduated, you are required to provide transcript from the university. So that's the norm for the university requirement. But if you're a current undergraduate student, what usually they will provide is that they will provide a PDF version of whatever. For example, if you are a PolyU undergraduate student, then you will go to eStudent, and then you can get the information from this from the eStudent system. But eventually, by the end of the day, we were mentioned earlier. For example, Angel mentioned that for language requirement, you will have some meeting conditions deadline. If you are, for example, currently, if you're an undergraduate student, maybe your final year, you do not have a degree yet. But because you are admitting to a master top postgraduate degree, you have to have an undergraduate, you graduated from a program. So by the end of the meeting condition deadline, it very much depends on when you are when we give you the conditional offer. So individuals, admittees, it may have different meeting condition deadlines. However, if you're undergraduate student now, your meeting condition deadline will not be too early because you won't get graduation information by the end of perhaps May in 2026. But then by that time, then the meeting condition deadline, you will be required to provide the transcript. And majority of the Hong Kong universities, local universities, usually you'll get your transcript 1 month after your meeting graduation requirement date. And for overseas university, you can always ask the transcript after you fulfill the graduation requirement. So it happened like that in the past. And for entrance requirements about English proficiency or Chinese proficiency, if you are having DSE, CEE, or IB result in 2008, it is okay.
No expiry.
Yeah, no expiry date for those requirements. The university only set the expiry date for the validity period for HSK results, same as for English requirement. You have been graduated from DSE, ALE, or IELTS, DSE or ALE or IB some time ago. There's no expiry. However, for TOEFL and IELTS result, then the validity is only 2 years. And the PolyU Academic Registry mandate that, so the test result only on or after 1st of July 2004 can be accepted this year. If you applied before, earlier, last year, you need to take a notice that this is changed. So before the grace period is a little bit longer, so now they make it a little bit more stringent. So you need to be aware of this. And yeah, so how long can the study be extended? So I think this question is about the program duration. The program duration is 2.5 years. Unlike certain studies, by the book, there's no extension. So everybody will complete their study in 2.5 years. But in practice, practically, what happened? We do have students, they may have some, majority of the time, there are 2 conditions. People will defer their study. First condition is due to health issues. We do have some, unfortunately, there's some students, they may discover that they may have some catastrophic disease, and then they want to defer their study for a certain period of time and then return a bit later. So happen like this. This is a first kind of condition. The second type of condition is that in this type of academic program, if student cannot pass through certain component, for example, maybe in the first year of study in the summer term, summer semester, the student have to be doing preschool clinical placement, but student cannot get a pass in this placement component, then the student have to defer 1 year, wait until next summer to start this academic subject again, which is the clinical placement subject. And then that is the reason that they defer their study. Other than that, I can hardly think of some other chance that the student would defer their study. So this is what happened. And scholarship, any other scholarship can be applied now. As far as I know, there's no other scholarship other than the scholarship that we mentioned earlier. That means that is our department scholarship. And but there will be some other financing option for this study. We know that MST is not a cheap degree on monetary terms. So because I think now the current is 6,800 per credit. So you need to pay for 90 credits. That means it's more than half a minute, right? But so it's more than 600,000 Hong Kong dollars to do this degree. A lot of our students, then they will apply for the non-means tested loan from the government. So there's another student loan from the government. So it's a loan from the government. It's non-means tested. So that means you can borrow money from the government. But I forgot the exact amount right now, but there is a upper limit. I think it's somewhat about, it's like about 300-something thousand dollars, is it? Yeah. So, but you can feel free. Either you can email Mabel, because we do have the last slide. Yeah. You can for administrative issues, for example, about loans and things, you can email Mabel. She can get you some information on the non-means test loan from the government. And actually, there is one fellowship for the coming cohort as well. So for there's one scholarship opportunity actually, and I think I will add that back in this slide that maybe in the next 2 days, because in 2025 admission, that means this cohort, and the coming cohort 2026 admission. So there is a government postgraduate fellowship program in which that the student that they can get this. How many got it? Is it 9 or 10 student? 10 student out of our 30 students, and they will get this fellowship, and they will be given how much? 100,000 or 120,000? I will add less information back to the slide there. I'm sorry, I forgot about it. Yeah, so that is not alone. So if you can, it's merit-based assessment, and they will be, they have to apply. And then you have to apply, but we will tell you that you can apply, and then you'll be vetted by the academic registry. It's the whole university arrangement for that you can see it as a scholarship, so but they call it a fellowship by the government, and then you will have that amount of money given to you to settle the tuition fee. So I will add that back. I'm sorry, I forgot about this.
Okay, there's a question about the early round and main round application results to be released. At what time will be released? Normally, the results will be released around 2 weeks after the interview. Then, if you're invited to the early round and main round interview or the second round of interview, if you don't receive the offer at that moment, after 2 weeks of the interview, it doesn't mean that offer will not be given to you. And basically, all the result will be released by April 2026. So stay tuned for the result.
Right, so there are more questions related to language. Let me try to address them one by one. There's a potential applicant asking if she got the following results, whether she can apply MSc or not. So one would be DSE only level 4 in English. Unfortunately, the answer is no, because we do require level 5 or above in DSE results. IELTS 7 in 2022. Unfortunately, as we also mentioned, that's too distant, and the cutoff date is July 1st, 2024 for the test date. And level 1 CRE, we do require level 2 instead. So the short answer would be that given the current profile, you do not yet fulfill the English requirements, and you do need to take an English proficiency test to prove that you can meet the requirement. And then another question is about MST only for bachelor students, degree holders, are also okay for current master students. Yes, as long as you have had a bachelor degree. Yeah. And so that will be it. And then there is another question regarding language. Took Chinese Gaokao in China. Necessary to take HSK test for Chinese proficiency? The answer is yes, we do. We only recognize the tests that we've specified in the slides. And any exam for Cantonese proficiency, as far as we are aware of, we don't see there is a formal Cantonese proficiency test out there. So the answer is that you don't need to sit for an exam for Cantonese proficiency to prove your Cantonese proficiency, but we do require Cantonese proficiency. And we would during your interview, if you're shortlisted, the panel members will be able to judge whether your Cantonese proficiency is adequate or not. Yeah, okay. And the other one is HSK exam. Yeah, 240 including oral exam or only written parts. My recollection is that it refers only to the written test, not the oral exam, and that's because if it's the oral test, then it's got HSKK. Yeah, it's like a separate CAT test with a different scoring system. But please do double check with our admin team colleague Mabel. Yeah. And then there is this need to submit bank statement. Not clear about what you're asking. If you're talking about payment proof for your application fees.
No, you
Yeah.
to apply, you only need to pay $500 to
Yes.
follow you. And we don't require you to have 600,000 in your bank account. Now, the reason is, but I do need to stress because for our big colleagues that you will pay the tuition by credits. So if that semester you started, and then so you will be charged the credits and time 6,800 Hong Kong dollars for each credit for the credit. So then you will settle the tuition fee in the by the deadline, and that's it. And for student, we do, like I mentioned, for local student, they are qualified to apply for the government nominee tested loan. If you apply for the loan, and sometimes, usually in your first year of study, because it will, even we issue the letter to our student by the end of August, student need to apply for that. If I can recall correctly, our finance office will ask students to settle the fee by the end of September for the larger amount of fee. You already pay your caution money, but then you need to pay the larger amount to settle the fee that is due for the first semester of study. And by that time, sometimes the non-means tested loan is not released to you yet. And the student has to settle the fee themselves first, using their own resource. And then after that, then they will get the government loan to release to them. Because as far as I know, as our finance office is concerned, the government loan not yet released is not it would not be accepted as a reason for not settling the composition fee. So this is what I know. But then you don't need to show us, and then please do not send us very sensitive information in the system, because I think it's beyond our scope for admission. Yeah, to that.
Okay. Okay, there's a question about the selection process, whether it's first come, first served or process collectively after all rounds of interviews. So basically, MSc admissions operate on a rolling basis, and we do have several rounds of interviews. And after each round, for example, the first round, we will consider applications before 15th of October. And after this round of interview, on the 13th of November, we will consider the application, and we will have a process, a selection process. And then if the result will be released around 2 weeks after the interview. Some of the applicants will receive offer, but then for those who don't receive the offer, it doesn't mean that you will not get the offer later. And then we will have the second round of interview, which will be on the 9th of January. And during that interview, we will consider application before the 5th of December. And same as the first round, we will have the selection process immediately after the second round of interview. And we will provide the offer after around 2 weeks after the interview. And then all the results will be released in April 2026. So I cannot say that it's a first come, first served process, and it's also not the case that we process all the information or all the interview results collectively.
Yeah, I can supplement a little bit, because I think some of you may be interested to know, okay, how many do you assign, how many places, for example, out of 30 places, how many places will be issued after which round of interview? The fact is that we do not have such number.
particularly, I think this will be the first year we are running three interviews. So, and I actually don't know, well, now we have some application in the pool, and then because sometimes we don't know, sometimes by the deadline, the day of the deadline, suddenly there are hundreds of applications popping up. So actually we are not sure. Of course, honestly speaking, if there are only 10 applications in the pool, I think we may not arrange an interview because I think we can't really select people because it would not be 10 out of 10 and then we are arranging an interview. However, if we consider that we will interview a certain number of people and then we will see merit basis again because I think we have been doing admission for quite some time and then we probably have some idea for what kind of student that we would like to make an offer as early as possible. So chances that if you are invited for the first round of interview, then certain number of people will be having an offer. So the offer, if you fulfill all the requirement of degree, English, Chinese, then the offer you get is already firm offer. And then, but if you are a final year student or you haven't fulfilled the English or Chinese requirement yet, then you will be given a conditional offer. But again, that's a real offer. So you only need to fulfill the requirement. But unfortunately, if some of you that are so unfortunate, touch wood, that someone cannot graduate suddenly, then by maybe May, then you notify us that you can't fulfill the requirement because you can't graduate from your own program. Then your place will be released and then we will see from our admission pool and then we will top up a student. So that's why Olivia was mentioning that we will issue offer after November interview, after January interview, and after March interview. But if you're not giving an offer like by the end of March, that doesn't mean that 100% you have no chance to be admitted. If there are places released, and then we will still get the list to top up, and then so that our place will be filled. Because we also know that still the program is competitive, and then we would like to issue the offer as long as they are available.
I'll answer two quick questions. One is, will the program focus only on specific population or not? We mentioned before we cover the full scope of service. That means across the 4 disciplines and 4 different areas and across adult and child. So that's a quick answer to that. Another question is about 300 students apply and only 100 of them be chosen for interview. Basically, this is a rough estimation. It depends on the quality of student applying and also our availability of interviewers. I pass on to you, Angel.
Right, there's a question about GPA requirements. Over 3.3 question mark. Okay. The short answer is that we over the years we haven't really specified a cutoff score for GPA. That's because we also consider the ranking of the graduating university. And I would say if there's an applicant whose GPA is 3 or above, then our usual experiences will be that the applicant would still be considered, would not be disadvantaged. But we would also but if the applicant is like below 3 in GPA, it doesn't mean that there's no chance, and that's because we would also consider the ranking of the university. For example, if it's a lower GPA, but then it's coming from a very prestigious, very high-ranking university, that would be given merit. Yeah, that would be given credit. So we look at it holistically. Then there's another question about, do students with reference letter have higher chance to be admitted? It depends, I would say, because it depends on how strong your reference letter is, of course. Yeah, and what we can say is every other thing's being equal. If there are 2 applicants, every other thing's being equal, the applicants with a positive reference letter, of course, will be weighted more favorably than the other one that's not. So everything is like holistic, but that's like the scenario we can put forward. Yeah. Okay. Okay. And then there's a question, can still apply before taking English test? Yes, but as we said, you need to, when you apply, you need to provide proof that you've registered for the test. Yeah, you have a proof of registration, that you have registered for particular dates of testing. Can submit supporting documents after application. It depends on what kind of supporting documents you're referring to. If you're talking about the required compulsory documents, we do encourage and expect applicants to submit all required documents when they apply. Otherwise, the application is considered incomplete, yeah, and may risk not being reviewed. And having said that, the only exception would be that if you're referring to English test or Chinese test proficiency results, then if they're not yet ready, you can provide a proof of the registration, and then provide the proof that you fulfill this requirement afterwards. If you're talking about reference letters, for example, because these are supposedly optional, then it is possible, yeah, to submit the supporting documents after the application.
Okay, so comes to a couple of, okay, we change a little bit of question on someone is asking any tips for group interview preparation. Now, actually, group interview, I think one thing Olivia did mention earlier, that you have to be punctual. We mentioned this again and again because every year there will be someone who is late. And the other, I think the advice is that basically you don't need to prepare. The reason of so-called PBL taster is that actually we don't know what we are going to use for the interview yet, because we will usually take a look at whatever journal article available, and then we will use it. And then we actually have a number of journal articles that we will just do it randomly. I think applicants are not being assessed on subject knowledge. We do not expect you to know the subject knowledge before you actually enroll in MST program. However, my advice is that do speak, because every year there will be it's a group interview. It's short. We have roughly about 18 or 20 minutes in the discussion. And all the time there will be always one or two applicants. They are too worried, and then or they plan too much and they didn't speak at all. I will only say that if group interview is part of the interview component, then the person not speaking at all will definitely score 0 for that part. And that's true, because we cannot rate an applicant for he or she did not actually engage in the discussion. So, and for applicants applying from overseas, such as someone studying or working overseas, and also we do know that Zoom may have certain drawbacks. For example, there may be a little bit of delays. So we will advise if for those applied from outside Hong Kong, actually, or even you have a job in Shanghai, then you are applying outside Hong Kong. We also can offer you Zoom interview. You don't need to fly back in person. But there's pros and cons. Of course, you are always welcome to join in person. However, we also provide a convenience, but we cannot factor all the drawbacks of a Zoom interview into that. So first of all, you need to go to somewhere with very, very good internet connection without not too much issue, and you make sure that your device is okay. And also, you need to find a way to maybe use the raise your hand function or use your facial expression to make sure that you can engage in the interview. Because we do have set up of a group interview, but I think it's also on individual basis how they can join the interview more actively. Other than that, we usually have pretty vibrant discussion, and I think our group interview are pretty enjoyable. I mean, at least as an interviewer. I don't know for interviewee. I should ask them.
Okay, a quick answer to the question is they ask is it different from other institutions? Example, CUHK. Yes, all the master program I know today in Hong Kong, they are all Hong Kong ISD endorsed program. So in that sense, they are equally effective in producing entry-level speech therapists. But then, of course, every single institution's program is a little bit different. They're different in terms of their educational philosophy and also influence in their strength and also in the way of delivering the subjects. So it's up to you to explore the differences, see whether it's suitable for your own learning style and whether do you like it or not, or is it suitable for your own way of study. So I guess you can have a choice there. And
Yeah.
one question for
Okay,
Janet.
And there's one question on when you will be, how long you can think about whether to accept the offer or not. I'm not 100% sure, but I recall that it should be only matter of 1 to 2 weeks. When you are given an offer and then you, for the PolyU requirement, you didn't pay money to secure your offer. This is what I know. But if you really want to be sure, please email Mabel Tong, because for all administrative matters, she's a lot more sure about it because she handled the administration of the program. And so Dr. Ng mentioned about, the couple. Okay, so reference letter, okay, whether it can be submitted by the applicant or by the referee. Yes, there are some other university, they require confidential reference. Right now, PolyU does not require confidential reference for application to this program. So what you do is that you can secure the application letter, the reference letter from your references, your selected references, and then you ask them to write a reference letter for you. They can give to you, and then you can scan and then do the, you can upload it to the application system. However, there are chances that if you invite your reference to write a letter for you, but the reference would like to submit the letter to the university directly without letting you know what he or she write about you, that is also doable. Please contact Mabel. I think last year we do have
a couple.
We have a couple of references like that, but because if for that way, Mabel will be able to help you to put that letter into the system so that our panel can see it. Okay, so this is it. And we have a question on age limit for applicant, and the oldest student that was submitted. Oh, I'm sorry, I cannot tell you the age of the student because it's against the rule. We can't say that. But then, because I cannot say that, okay, who is the oldest? And yeah, it's we can't say that because we do not discriminate on student or staff. I will not tell you my age too. So but there's no age limit for the applicant per se. So I think I can't recall, but then we do invite applicants of different age groups to come for interview. I can just tell you a very interesting story that we do admit some students that they work for a certain number of years. And then, but the student actually very happily told me after, well, we know each other for a while, and she said that, don't tell my friends here, nobody know my age. Don't attempt to even leak my age in any way. Don't tell them that I worked for whatever job before. I said, okay, so because the issue is that student was working in government, and then if you can't, when he got promoted, then you will be able to kind of guess her age. And then so she prohibited us in talking about that at all. But actually we will not talk about that, but she's just making fun on that. But yeah, we don't have age limit. It's mirror basis. And but of course, I think you need to, if a fresh graduate, then you're applying to the program. If you're invited for interview, then you need to prove to the admission panel members that if you do not have any work experience, but how are you being mature enough that we should admit you? For the same, if you have been working for a certain job for 20 years, and then and if you didn't show in your CV you have done quite a bit of study, then the question will be the same. The young one that they may be very familiar with university study last year or a couple of years ago. And then so we don't question on their ability to do a high intensity university study. And then, but we question on their maturity, on their work experience, on their people skill. For you, you may be successful in working for many years in your chosen profession. Then I don't have question. I may have less question on your maturity and your people skills. However, we will have question on your ability to handle a high intensity program. So it will be up to you to prove to the admission panel members how you can demonstrate such skills.
Okay, there's a question about how long does the CV take? There are altogether 7 clinical practicums in this 2.5 years of study. And every semester we have 1 clinical practicum. So it will last for around 2 to 3 months per clinical practicum. However, it doesn't mean that you have to go to the clinical placement setting every single day. It's very likely that you go there once per week. Yeah, 1 or 2 days per week, and you will gain a total of 300 clinical supervised hours during graduation. And then there's another question about the schedule in a week as an MSc student. I think it's quite difficult for me to answer this question now because every year the schedule is not exactly the same. It depends on how the lectures are arranged and the clinical practicums are arranged. And because in arranging the clinical practicums, we have to collaborate with other settings, different organizations like schools or preschool settings and even hospital settings. So we don't have a fixed schedule. Basically, our study is a full-time study. And
our students are available on 6 days a week. Monday. I can show you like this semester, for example, like both Olivia and myself, we teach our year 2 MSc students. If we talk about a year 2 MSc student, and then their Monday and Thursday morning, then they will have a problem-based tutorial. And Thursday afternoon, they will have their clinical placement subject is preclinical training. And then usually Tuesday, Wednesday, or Friday mornings, then they will be having some seminars on certain clinical topics. And they will also have some clinical placement on oral rehabilitation about hearing loss children. And then, but they are in different groups. Some group will have it on Monday afternoon, some will have that Tuesday afternoon, and I think one group will have that on Saturday. So that's why we said the students are available 6 days in a week, and then it depends. And you should also know that clinical placement is different from academic learning. For next semester or even summer semester, our regular teaching, lecturing, this type of schedule, we are very sure about it. However, if you ask me about January clinical placement schedule, exactly whether this student will go to Monday group or Tuesday group, we cannot tell you yet because we haven't secured the clinical placement site yet. And also we haven't secured the client yet because actually this client will be enrolled a lot later. So we cannot, we are not very sure. So usually students notify the exact schedule about 2 or 3 weeks before the clinical placement. That is pretty normal for component.
so you mean students are available 6 days a week for
that, but you don't need to
study.
do really 6 days a week. But full time, yeah, because our teaching. Our possible teaching day in this university is Monday to Saturday. So, but you don't need to do 6 full days. Yeah, like that. So, some other, I can answer some first. For non-local student, whether you are eligible to apply for scholarship. Okay, so for the scholarship, we talk about everybody can be included, which is the LST, our departmental scholarship. Yes, you automatically go into that. For this scholarship and for the graduation prize. But for the Hong Kong government fellowship, that one is only available to permanent residents in Hong Kong. Yeah. So this is it. Application logistic, where to upload the Chinese proficiency certificate. If you go into the e-application system, and then the e-admission system, right? And so like that, yeah. And so the e-admission system, then you can upload different things. But some applicants, because the system is like that, they will have a few places you can actually upload your certificates or letters or whatever supporting documentations. But there are only a few places. So what usually applicants do is that you can combine multiple documents into a file and then you upload via e-admissions.
There's a section on additional documents. So you combine all your other documents into one file and then upload to the additional documents section.
Okay, one quick answer to two questions. One on whether group interview and individual interview are happening on the same day. Yes, they are usually arranged on the same day. And second is will the video of this session be uploaded? Yes, it will be uploaded maybe within 1 week.
Okay, there are two questions. One is about the number of people in the group interview. It should be around from 6 to 12. It depends on the candidates applying for the course and how we depends on the shortlisting process. And the other question is how the interview invitation is released, and we will release through email.
So, and so what type of job reference will be helpful? Now, I can talk a little bit about recommendation letters. Angel mentioned earlier. So recommendation letter can be academic reference for some people, and then if you are strong in your previous academic work, and then you can ask your previous professors from the university to write you references. And for some people, if you are in a job that of course, I think will be like this. For instance, I think we have case that if you are you have been worked as an engineer, then the job reference by the engineer company, your supervisor, it may not be very relevant. However, the candidate, they can also offer it. And then versus another example, if we have a candidate who is a teaching assistant in a local school, then that kind of job reference will be a little bit, a lot more relevant. So that will be, I think it will be a good choice. And but then it's still your own choice of what kind of recommendation letter that you provide to us. And for example, if I'm really non-related profession practitioners, so they're getting a reference from your boss doesn't seem to be making a lot of sense, then you can give a reference. We do have references of people they volunteer, then they have a social worker of certain organization that they write for them, or we do have some applicants, then they go for whatever course about child development, then they ask, then I think maybe he or she know the instructor well enough, and then they can comment on the coursework or the enthusiasm of this individual. So I think that could be a bit open. So do note that we are not really looking at the reference letter only that proving, okay, this person has been in this job for 3 years, 5 months. Those are more employment proof, then those are not a reference recommendation letter. So we look for recommendation letter that when we read it, we will know more about you as a person. So why this person will be suitable to pursue speech therapy training. So I think this is what we look for. And MSc program, okay. So I think I have a question on whether MSc program is widely recognized overseas, whether our graduate can practice overseas now. Okay, I need to stress that we're a UGC funded institution. We're a public university in Hong Kong. So our main role is to train STs then they can practice locally. So for this reason, we would not seek endorsement by overseas organization. However, in practice, I can share with you how our graduates are doing. Because I think graduates, then they will always have some different opportunities happening in Hong Kong or overseas. I can recall that we have quite some graduates, they are practicing in Canada. And then, but you know, Canada is a big country and I don't have practice right in Canada. So I can tell you a little bit of what I know. And based on the provinces they are at in Canada, the requirement is not the same. Some provinces, then they will let you have your qualification vetted, and then you can get into certain type of qualification examination. And then you can, once you pass through those qualification examination, then you can get the practice right in that province in Canada. And for England, we also have quite some students and previous student, our alumni working in England now. And for England, because they have a HCPC, the Health Professional Healthcare Professional Council. So that's a government agencies. Then they will be vetting individuals in certain profession, whether they can practice as a SLT, speech language therapist in the UK, in England. And so for us, they change over time. Currently, as far as I know, because our alumni will contact us when they need some certification regarding their practice rights overseas. So they have to apply to HCPC with their qualification and their clinical practice component, and also some program documents from PolyU from us. And then as far as we know, and then England is currently using a vetting system by HCPC. And then as long as you produce adequate document for vetting, and then they offer them the license. So this is what I know so far. And then as far as I know, for Australia, it's a little bit different story. Australia, they use another system. Basically, they use competency-based occupational standards, in which we actually adopt that CBOT system in Hong Kong as well. However, Australia, their process of you produce your dossier for vetting is quite complicated. So as far as I know, I actually know MST alum who is now in Australia, but that alumni, maybe they are quite well off. They just think that, okay, it's too troublesome to produce a dossier. So the alumni chose to just do another master's degrees in Australia. What she told me, she said that it's faster and easier. It's just need money. And that's what she told me exactly. So I'm not sure if you actually do it, whether it will be okay to do it. But yeah, this is as far as I know. So, but of course, I don't know all the alumni in MSc program. And this is easy. Interview in AM, PM, or at night. It will only be in AM and PM. Okay. So this is the only night thing that we do now, which is to do a seminar. And because we do have admin support with our colleagues in. So we will do either morning.
One quick answer to the question. Maximum number of reference letter is shown on the screen. Two.
So yeah. So I think, we're sorry, we are running out of time. So we know that we usually have questions that we would like to address as much as possible, but don't worry about it. For those, if you're interested to meet us in person or know more about the program, of course, you can apply, and then if you can, you get shortlisted, you'll meet us a little bit earlier, and even in the November interview. But for those who may want to know a little bit more information, or even you applied, you have been interviewed, you are also very much welcome. Because I think we usually, the in-person, we do this online seminar because we want to first of all, answer a lot of questions from many people that you don't need to fly back to Hong Kong if you are currently not inside Hong Kong or applying overseas or in the mainland part of China. But the other is, what we know is that many people like to join the January seminar because you would like to meet us in person, you would like to meet our students, and also you can get to do visit to some of our facilities. So you are very much welcome to come to our January information seminar as well. So again, so this conclude our information seminar for this evening. So thank you very much for joining. And again, I will update the slide a little bit, and then we will try to upload to the to our website in 1 to 2 days time. And other than that, and then you will have a recording of this information seminar, but the recording will take a little bit of time. Usually we will upload to the website within a week of time. But again, if you do need any more assistance, first of all, you can always send email to Mabel, because Mabel will be able to answer most of your questions. But if you do have academic matters, for instance, if you want to know exactly our curriculum design or our clinical placement design, for those questions, you are welcome to email me. And then because usually we will answer those questions. And for all the general information questions, we will direct to our general office to answer your question. So again, thanks for coming, and we do hope that to see many of you in person later in other activities or in the interview. So good luck with everything, and good night for this evening. Bye-bye.
Bye now.